Hi, everybody, and welcome to the OET webinar by MedExam Expert. This is your OET speaking modules mentor, and my name is Dr. Jaweria Naqi. Uh, if you guys do decide to join this course, then I will be with you guys for 4 weeks, assessing you with the speaking module of OET specifically. So, let's start the welcome. The session. Today's topic is importance of feedback and empathy in OED speaking. So let's just go on and just read about what this really is about. Okay, so before we go on with our designated topic, let me just tell you how the OET speaking module works. Okay, so there would be an interlocutor and you would be given 2 role-play cards by that particular interlocutor. That role-play cards would not have any gap in between them. They would be back to back. They would comprise of 3 minutes of reading the role-play card, and then you would be told by the interlocutor to start presenting. You would be given 5 minutes for the presentation. So total, you would be provided with 7 minutes for each role-play card. Okay. And then before you start your role play card with the interlocutor would just conversate with you for a couple of minutes, like 2, 3 minutes. So I get this question a lot by different students that those questions that interlocutor would ask us, would they be graded? So the answer is no, they would not be graded. It would just be a regular speaking exercise for the interlocutor to get to know about your voice, your intonation, about, nothing more. So you would just be, it would be just a normal casual talk like how we do. Okay. Apart from that, the next question that I get is that do we have to always introduce ourselves even in the emergency settings? So my answer is yes. We always have to introduce ourselves because as a doctor, it's the medical code of ethics to just go and introduce yourself and to ask for the name and age of the patient as well. You guys will get to know about all of this as we move on in our sessions because to cover everything up in one session is nearly impossible. But I'm going to give it my best shot. Okay, I think Ashi raised her hand. Ashi, you can just talk without raising your hand if you guys have any questions. Just, this is the whole reason for this webinar. You guys can interrupt me in the middle and ask me questions. I'll be happy to answer. You guys don't have to wait for the class to end. Yeah, go on, please.
Yes, Doctor. So there is this confusion that we get 5 minutes to talk, and is it more important to keep on talking till 5 minutes are over, or is it more important to finish off all the tasks and then summarize and then hand over a leaflet and then say, okay, speedy recovery and all?
Yeah, this is a great question, Dr. Ashi. So, what you have to do is you have to finish the task. That is your priority. You don't have to keep on speaking until 5 minutes. I never spoke for 5 minutes. I usually used to sum it up in like 4 minutes, 30 seconds, 4 minutes, 15 seconds. It's better to sum it up earlier than to take your time and not finish and for the interlocutor to, pinpoint at you and be like, hey, your time is over. So you don't want to go down that route. For me, it would be better to just finish all the tasks and just summarize if you have time. There's no scoring for summarization. Only summarize if you have time. If you think you don't have time, just move on without summarization and provide a leaflet, as you said, if it's necessary. Have you been in my previous session, doctor? Because
Oh,
all of this sounds familiar. No, no, this is your first time?
no, I have gone through. Yes.
Okay, all right. Okay, so yeah, I hope I answered your question. All right, so coming back to what we were talking about. So first of all, you're gonna go and you're gonna introduce your self and be like, hey, my name is Dr. Asif Hashmi. You can just talk to me. You don't have to raise your hand, just talk.
Okay, ma'am. Ma'am, may I ask how to introduce oneself in an emergency setting? Like, for example, in a outpatient setting, it's okay. The patient is okay, is not serious. But in an emergency setting, is it necessary to introduce ourselves because the child or the person could be injured or could be in critical condition? How would we introduce ourselves in that
It's
condition?
always necessary. So, Dr. Asif, when you work in a normal medical setting, you do introduce yourself, right? Even though if it's, unless and until it's a comatose patient that just came to you, you always go and be like, hey, my name is Dr. Asif, and I'll be your presenting doctor for today. Can I please confirm your name and age on the file? It's extremely necessary. The interlocutor over there is marking you for these pointers. If you miss out on them, then they would not mark you for this particular thing that you missed out on. So always introduce yourself. Don't think that this is an emergency setting, the patient is in a lot of pain. You always have to just go in. It will barely take your 10 seconds, right? It barely took my 10 seconds when I
Right,
did that sentence to you.
right.
So,
Okay, Dr. Jaweria, I have a
yeah,
question. If
yeah,
the
go on,
patient come
please.
with a child, so it is necessary to know the name and age of the child, not the patient, matlab not the parent, right?
Yes, the name and age of the child is extremely important. For the attendant, you would go on and ask that, hey, can I please know your name? And the mother would be like, hi, my name is Linda. And be like, okay, can I please know the name and age of your child? Your primary
Okay.
concern is the child, not Linda, right?
Yes, yes.
You ask her name out of courtesy of your profession, because what if you want to address her in the course of your meeting, right? That's why you asked her name. But after asking for her name, that's it. You're not talking, you don't care about Linda's age anymore. You are concerned about the child. So always
Okay.
ask for the name and age of the child. I usually get this question that, hey, the age was written. It was written that he was an 8-year-old boy. It's okay if it's written. A lot of other things are written, right? But you still ask,
Okay.
right?
Okay,
So,
doctor. Okay.
um,
One more question.
go on.
If there's a returning patient, then how we should introduce ourselves?
Oh, it's a good question. I do get this question a lot. Okay, so you have to go and be like, hi. So I always tell my students to incorporate a line that tells the interlocutor that you know that this is a returning patient. So you just walk in and be like, hi, so since we talked about this last week, tell me about the disease. How is it progressing? What's going on? Just a little something that would tell the interlocutor after introduction. Always
Okay.
introduce. Always ask
Okay.
for the name and
Okay.
age, and then say something that will tell the interlocutor that you know the drill, that you know that you're seeing the patient for
Okay, Dr. Javeria,
the
can we
second time or the third
like
time.
okay? So can we say that for a gentle reminder, you came here yesterday with this reason? So can we say in that manner?
For the gentle reminder,
You visited
you
me
can,
yesterday for abdominal pain, so I requested an
yeah,
ultrasound.
just be like,
So
hey, oh yeah, so since, yeah, I saw you yesterday and you're here to collect your results.
yes.
So just tell me, how are you feeling now? Did the pain get
Okay.
better? Something of that sort.
Okay. Okay.
Um,
Thank you so much.
no problem. Okay, so you walk in, you introduce yourself, you ask for the name and age of the patient. You always ask the patient how they would like to be addressed. This is the rule of thumb. Write it down on a pen and paper if you guys have it, and I encourage all of you guys to be having a
Hello,
piece of paper and pen. Yes.
hello,
Yeah. Go on, please.
Dr. Jaweria.
I can hear you.
If the child,
Yes.
uh, I am Dr. Saima. I have one
Hi, Dr.
question.
Simon.
If the child is a 7 or 8 year old, so we talk or introduce ourselves. Sorry, hello.
Hi, yes, I can hear you, and I heard your question. So, Dr. Simon, we never talk to the child.
Yeah. So if the
In OET, we never talk
okay,
to the child. We always
yeah,
talk to the patient, to the attendant, sorry, to the mom or dad. Yeah.
to the mom and dad regarding her condition
hmm
or his
To the
condition.
mom. Yes.
Okay.
Yes. To the mom
Okay.
or dad. We do not talk to the child ever. Never. If you would never get a case scenario in which you would be asked to talk to the child. Okay. Now, can you guys please give me 2 minutes to finish what I was what I'm trying to say for the last 10 minutes, and then we will continue with your guys' questions. Also, if you guys want to pour in more questions, you guys should hurry up and sign up for the med exam expert course, because then you guys would have plenty of times and you guys can just pour in your questions, and we have like a private WhatsApp group, and over there the mentors are available to answer your questions 24/7, day and night. So hurry up and sign up for the course so that you guys don't miss out on the opportunity. Okay, moving on. So we introduce ourselves. My tempo has been broken so many times, but it's okay. I'm glad you guys are opening up and asking questions. But just give me 2 minutes. All right, then you please write it down on a piece of paper so that you guys remember. And then you guys go and be like, hey, so I'm Dr. Jaweria Naqi. I'll be your presenting doctor for today. Can I please know your name and age? And the patient would be like, hi, my name is Alex, or my name is Linda. I'll be like, hey, how would you like to be addressed? And then they would be like, you can just call me Linda. I'll be like, okay, Linda. So, what brings you here? And then you just go on with the history, a little bit of history. And then you move on to, like if examination is required, examine. If not, move on. I always tell my students, always examine if you are in doubt. If you are in doubt, examine. There's no cons of examining. There's cons of not examining, and the interlocutor would write it down that you did not examine. But if you examined, and if you were in like in a doldrum that, hey, am I supposed to examine? Am I supposed not to examine? Just examine, just for the safe side. Go on and do the examination. It's only going to take you 5 seconds. How is the examination done? As we all know, it's just a pretend play. So we say that, hey, can I examine you? I'll be as gentle as possible, and you can stop me whenever you feel uncomfortable. So the patient would be like, yes, please, go on. You examine the patient, and boom, you're done. It took only 5 seconds, but you checked, you ticked off one of the things from the interlocutor's checklist. So, okay. Also, if the patient is with their child, you're gonna ask the parent, right? That, hey, is it okay if I examine your child? Okay. So the first thing after examination, what I encourage my students to do is empathy. It's sympathy, it's the feedback, it's the reassurance that, hey, I'm so sorry that this happened to you, or I'm so sorry that um you went through this. I'm sorry, blah blah blah. So just be like, throw a little bit of sympathy and empathy, because there's marks for that in the interlocutor's checklist. Always be empathetic, always be sympathetic, always reassure the patient that everything's going to be all right. You have to incorporate sympathy in your role play card somewhere. I usually used to do it right after my examination so that I don't forget it, because it's extremely forgetful, and you forget to do to come, to say some good things, and just come up with something empathetic, and the interlocutor notices it obviously and deduct your mark. So I get a lot of students that tell me that, hey, this is my second attempt, this is my third attempt, and I do everything right, but I don't know why I fail. So these are the little tips and tricks that the interlocutor is expecting. Not the part that you just go there and speak is enough for them, right? There's certain medical ethics that you have to perform in front of them. For instance, I got this student once, and she was there was a role play card on acromegaly, I guess. And she just said something under the lines of that, okay, so this is a very normal condition for your child, and don't worry, we're gonna send you for some test and we'll find out. So just the fact that she used the word abnormal is itself not a good medical jargon. We don't use abnormal anymore. We don't say abnormal anymore in medical terminologies in the medical field. So I'm just giving you an example that just this thing, if I would be an interlocutor, I would deduct her mark immediately, and I'm sure that interlocutors do deduct marks over all of these things. One more question that I get is grammatical errors. If you do a couple of grammatical errors, like teeny tiny, itsy bitsy, like one or two, it's okay. They don't worry about it. If your speech is full of medical errors, then yes, the interlocutor would definitely, definitely write that down. Okay, coming back to our slides now, if you guys want to ask me questions, you guys can stop me in the middle of my speech and ask me questions. It's okay. Feedback is important to take feedback from the patient. It's important component in marking criteria. Feedback is like you just ask the patient in the middle that, hey, are you understanding me? Am I okay up till now? Are you listening to me? Is it okay? Is it clear? Always do active listening. Always ask the interlocutor that, is it okay for you to carry on? Because there's questions that interlocutor wants to ask you as well. And if you don't stop, and if you just keep on talking, the interlocutor will not be able to ask those questions. So basically, you're supposed to check that if the patient is able to grasp and understand the information about the disease that you're providing them with. So the sentences that I would personally use would be, is that clear? Am I clear so far? How does that sound? Always ask these questions. Like if you perform task number 1, okay? After doing that, you ask your interlocutor that, hey, are you clear? Am I clear? Is that okay? Like, do you think you can pull that off? Do you have any questions so far? So that the interlocutor could go ahead and finish his task. You know what I'm saying? So always do that. Okay, so you have to be as polite as possible. You have to ensure the patient that you understand what the patient's going through. Okay. Then we move on to empathy. Like I told you that empathy is extremely important ingredient, and you have to incorporate that ingredient into your speech. The sentences that you can say is, I'm sorry to hear that. It must have been very painful. I would acknowledge if you guys could write that down, because sometimes like we're struggling for words and sentences. So write it down if you have a pen and paper. Go ahead. Okay. I appreciate your fears, worries, concern, condition. Do not use this sentence. It's not accepted in the latest medical jargons, in the medical vocabulary. We don't say that I appreciate your fears, or oh my God, I get such students a lot who say, I appreciate your worry. I appreciate your anxiety. No, you don't appreciate anyone's anxiety. Okay? You understand someone's anxiety. You acknowledge someone's anxiety. You don't appreciate anxieties. So don't use this word, please. I have to remove it from a slide. I forgot to do so. It's not originally my slide, but okay. Anyways, so you don't say that word, okay? You never use that sentence. Just say that, oh, I know it must be really stressful for you. I'm so sorry this happened to you. I can totally understand your concern. I can understand what you're going through. So just stuff like this. Just okay. Reassurance. What is reassurance? To tell the patient that it's gonna be all right. It's gonna be okay. So let me reassure you that eczema is self-limited. Let me reassure you that you would get better with time. Let me reassure you that the prognosis of your disease is good. I'm sure you'll feel better in a few days. So these are just the reassurances points that we okay. I'm all ears for the questions that you guys were asking. Before we move on to the questions, please sign up if you guys haven't signed up yet. It's a life-changing experience. I have done it personally myself, and I passed in my first go. Okay, ask questions if you guys have any, and then we might be able to move on to the live session. Um, okay, okay, so hey doc, are you American? I am not American. I'm Pakistani, but do live in America for the last 8 years. So yeah, I'm an American resident. Okay, hello doctor. Do we have to introduce ourselves even if the scenario starts midway, like after completing the physical assessment? Um, I don't understand your question. Like, do we have to? The scenario it never starts in midway of the physical assessment. You always have to introduce yourself in the beginning, and then you move on from there. Like, you just walk in the room and be like, hey, my name is Dr. This, and can I please know your name and age? And then you move on to the next. You you cannot introduce yourself in the middle of something, right? So introduction first, and then we move on to examination, then we move on to history. So it always have to be like in the descending order. Okay, so do you have any more questions? Do you guys have any more questions?
Doctor, how about arranging it this way that we introduce and then we ask about history, like what brought the patient here, and then we go about examining. Would that be okay?
Yes, that would be perfect. That is actually the perfect sequence that I'm trying to tell you guys. Please do the examination, the history, obviously, that what brings you here today, and then all it would be written in your role play card, but you still have to ask, just how you still have to ask for the name and age. You still have to ask about the history, and then you move on to the next thing. The charges, Tazeen, that would be told to you by Faizan. You can reach him out after the session.
How should we, ma'am, how should we
Okay.
respond to a patient if the patient A is aggressive, and secondly, B, if he or she is silent due to any psychiatric issue?
Okay, so the patient would never be silent. The other thing you asked, aggressive. The patient would always be aggressive. Welcome to
No, I mean
welcome to
in.
OET. The patient would always be in a bad mood. So what you have to do is you just, play your calm and don't lose your cool and be very subtle and very like, very calm and easygoing. And eventually the interlocutor would fall into your trap. But in the beginning, all the interlocutors are paid to be aggressive and to be like, that, hey, I don't want to do this. I don't want to comply to this. I don't want antibiotics. I don't want the tetanus shot. You always have to tell them about the pros of doing so. And obviously, you cannot force the patient. You never tell the patient that you have to do this. Just tell them what your task requires you to do. And eventually, the interlocutor says, okay, all right, doctor, I'll do this. In the end, all the interlocutors would say, okay, doctor, I'll do it. So don't worry about it.
Okay.
They're paid. They're, yeah, they're like, how do I say this? So they're actors. Are the interlocutors over there? They're not doctors. They're not in the medical school. They're all actors. So they're trained how to act.
Doctor, I have a question. Now, okay, now during the exam itself, so when we have the speaking, so we have got like 2 cards. And as I've entered the room, I know the interlocutor. I have asked the interlocutor in the beginning, how do I address you? So, for example, the interlocutor has already told me that you can call me Rebecca. So this is the name that I'm using for the first card. So do I still introduce myself in the second card? Okay, hello, good morning, Rebecca. What brings you here? Nice to meet you. So because it's going to be the same name in both the cards. So do I still have to ask, or I can continue with the same name?
You cannot continue with the same name. You still have to ask. You have to go from the beginning. Have Rebecca introduce herself twice. All right? It's not costing you anything, but it's going to cost you something if you don't ask for the name and age again. So the second roleplay card is completely different genre. It's completely different from the first one. So it's going to be a completely different scenario. So whenever you finish the first roleplay card, always begin the second roleplay card from the beginning. This was a very good question, actually, but always ask for the name and age again. Everything is repeated again. And sometimes the interlocutor also changed their names. Like in my case, the interlocutor changed his name in both of my roleplay cards.
Okay. Doctor, I have a question.
Okay, yes, please, go on. Go on, please ask your question. I'm listening. Okay, I think we lost you. Let me know about the question whenever you come back. Okay, you introduce yourself in the same manner if you're a nurse. I used to have a speech pathologist in my previous session. We had nurses, we had doctors, so it's like a very wide range of people that we get at med exam expert. So it doesn't matter if you're a nurse. We have separate roleplay cards for the nurses. You go on and be like, hi, I'll be your
Hello.
nurse for today, and my name is this G. Go on with your question, please.
Ma'am, I have a question that who gave us marks in speaking, that interlocutor or someone else?
The interlocutor. The interlocutor is your examiner, he's your interlocutor, he's your actor, he's everything. He or she has a checklist, and he or she is providing you with the marks as you speak. There's live marking going on. I hope that answers your
Dr. Naqi,
question. The charges, Tazeen, are we supposed to what?
are we supposed to complete the whole task in given 5 minutes? If one task is left, that cost the score, or it's okay if we have continued, our approach has been empathetic towards the patient and we have answered his or her concerns very well.
Mm-hmm.
I mean, is it okay, or if we're supposed to complete all the tasks given on the card, on the role play card?
You're supposed to complete all the tasks, each
Okay.
and every single one of your tasks. We're gonna do in the next 5 minutes after I wrap up the questions, we're gonna go ahead and do one live role play card session with you guys so that you understand what I'm talking about. All the tasks should be
Okay, ma'am.
completed, doctor, or
Thank
else you
you.
wouldn't be. They wouldn't grade you. No problem. Okay, Dr. Tazeen Faizan would guide you with the charges.
One more question.
Yes, please. Go
Hello,
on.
ma'am. If a patient presented with
Yeah, go on,
her
please.
child, so how should we start? First, we should name the first we should ask the name of patient or himself.
So you asked, I think Dr. Dilip, I would be answering your question as well with this. You ask the name of the attendant, okay? You'll be like, for instance, I am presented with my child who was 2 years old. So you're my doctor. You go on and ask for my name first. You'll be like, hey, can I please know your name? And then I tell you, hi, doctor, my name is Jaweria. You're like, okay, how would you like to be addressed? Always ask the attendant slash the patient how they would like to be addressed. And I tell you that you can just call me Jaweria. I'll be like, okay, can I please know the name and age of your child? You did not ask about my name. You did not ask about my problem. You completely deviated your um thing onto my child. And then you went ahead and asked for the name and age of my child. If you write these things down, it's gonna be so easy for you because there's a lot of things to remember, right? So for instance, if there's a child presentation, you know what to do. You have to go ahead, ask for the name of his mom, her mom, and then ask the mom how she would like to be addressed, and then ask for the name and age of the child. If you remember this sequence, there's no way you're failing the exam. Okay, how to improve grammar?
One question.
Go on, please.
Okay, should we have to stop after every task and get feedback so that the
So
interlocutor
sequence is
can ask
important,
the
or
next question?
the grammatical.
Yes. So, for the ones who are not asking a question, please mute your mic so that there's less white noise. All right, doctor, to answer your question. What was your question again? I'm sorry. What was your question? Oh, to stop after each task. Okay.
Yes.
So,
Sorry.
sometimes I tell my students to merge two tasks and stop after two tasks. Sometimes if the task is bigger, it requires a lot of information, then I tell them to just stop after one task and ask the interlocutor if they're following him or her. So it just depends on the length of task. Um, I would usually merge two tasks. It saves your time and you're able to wrap up your role play card quickly because 5 minutes they go by so fast you wouldn't even know. So just merge two tasks and then as an interlocutor, that's
Okay.
easy following you.
Oh,
You know, like this
okay.
is a little tip. Yeah.
Okay. But if we merge two tasks, then interlocutor will he will also follow us, right?
Yeah. Yeah, totally. Why not?
Okay. Thank you, doctor.
Yeah, it's a little tip that I used for my exam and I conveyed further because people are not obviously able to finish their role plays in 5 minutes.
Yes,
So I always
exactly.
tell them,
Yes.
yeah, so I always tell them merge the two. That's what I used to do and it worked for me. So, you know,
Okay. Thank
Ma'am,
you.
no
ma'am, is it
problem.
okay? Is it necessary to follow the order of these task, or we can ask any task at any time? Or it's necessary to follow that order?
It is a good question, doctor. I get this question a lot and it's a tricky one because see, sometimes I do get students who they do not follow the order, but they perform exemplary good. And I get so like moved by their performance, and I'm like, it's okay if they even mess up with the order. But sometimes the order is very necessary to follow. So it just depends on the kind of task that you're getting. If I would be at your place, I would never mess up the order. I don't like taking that risk because you see the interlocutor's sheet is in the order of my question. His answer is in the order of my questions. So I personally would never mess up that order because I don't want the interlocutor to get confused. I don't want him to score me less because of my over efficiency. So I would always follow the order. I would encourage you to do the same. Uh, so doctor, I don't know like how you improve your grammatical mistakes, to each his own. That's what I would say. Um, I mean, you have to just read a lot, write a lot, and I think just I always tell my students do at least 4 or 5 role play cards a day. That would just help. If you join this course, I think you would be speaking so much that you by the end of it you would be uh we need live webinar session to be well prepared for AT exam. Thanks in anticipation. Okay. I got a scenario where the physical exam was already performed and the child was on the cart and enrolled the test was informed the condition of the patient. Oh, okay, this is really nice. Oh, good. Okay, so you got trapped there. It is very tricky. So no, you got it wrong. Doctor, you got it wrong. So, there is never a case or a scenario in OET where the physical examination is always done and you're supposed to, um, explain the findings. So you misunderstood it, you misinterpreted it. What happens is they tell you that you performed the exam on the patient and you found out that the patient is having PDA or the patient is having, some sort of murmur. The child is having cyanosis or whatever the thing is. And now you explain your findings to the patient, to the mother or father. You still have to dramatize everything. I think you probably failed your exam. That's why you're in the webinar again. Correct me if I'm wrong, please. So you have to, it's like dramatization. It's like you're provided a skit, okay? But all the things written on the skit, you have to do those skits. You have to do those things in front of the interlocutor again. It's not like it's written, so I'm not gonna do it. You're still gonna do it. You're still gonna ask for the name. You're still gonna ask for the age. You're still gonna examine. You're still gonna perform. You're still gonna tell the you're not gonna be like, hey, so hi, how are you? I'm sure that I have already examined your child, and let me just tell you that your child has PDA. I'm so sorry. Let me just refer your child to a surgeon, to a specialist. We don't do that. Okay? We do everything from the beginning. Perform, ask for the consent for performing on the child because he's a minor, and then do everything in the order. You would never get a scenario in which you would be, told to just, so you got tricked there, and that's why I think you failed the exam. Sometimes you get the scenario in which it's written that you have the X-ray results, and then the X-ray results is written that the patient has broken her little toe. So now explain the results to the patient. So you never just walk in and be like, hey, so I just got your X-ray results and this what it says. No. You always go and greet the patient, be like, hey, so you remember we had your X-rays done last week, so the results just came out. Are you ready for me to tell you about the results? Yes, doctor. Then be like, okay, so these are your results. This is what we do in imaging, like ultrasound was done, X-rays were done, blood labs were done, but in examination of a live person, we do it right there on the spot. I hope that answers your question. Okay. If there are more questions, please
Yes, ma'am.
speak up because
One
there's so
one
many
more
questions in the
question.
chat. Yes, go on, please.
Ma'am, the question is, if in the starting of the um, role play card written that patient come up with this and this, and you examine the patient, you find this, and at the down the tasks are written. So first we have to attack the history, then ask the all question. In last we have to tell that examination to the patient, or we have to initially start from examination that's written just above the role play card in the starting.
No, you always have to examine the child first and then As for the history, examine the child, and then you interpret your examination findings to the mother or father.
Ma'am, the sequence is that the first we have to ask the history related question and all the data. After that, we should examine. This is the sequence.
Yeah. Ask the question first, take the history first, and then you examine, and then you move on to the tasks that are written in your role play card. So you have to incorporate examination between history and moving on to the task session. Just somewhere in the middle, right after the history.
So on some role play cards, they're written that you initially examine the patient. After that, he's asking for taking the history. So, but we have to go in order first history and then.
Yes. Always go first for history and then examine the patient.
Okay.
Yeah.
Dr.
Okay,
Naqi,
so
could you please tell me
let's do a case.
could you please tell me some sentences, some potential sentences for breaking a bad news to a patient? Like we have the X-rays or the any scopy results.
Just be like, hey, I'm so sorry to tell you that this happened to you. We are very straightforward in OET. It's not something that we, like um it's just very straightforward thing because you don't have much time to just wander around something for so long. So just one or two sentences of I'm so sorry that this happened to you. I'm so sorry to share this with you, but we
Are
just
we
found out
supposed
that you
to
have a colon carcinoma.
are we supposed to give a pause, like to take let the patient digest the information?
Oh yeah, sure. After you said it, just be like, I'm so sorry that this happened to you. I know it must be hard to process, and I'm here for you if you need any help with that. But moving on to what we could do to increase the prognosis of the disease, let's just, then bam, you move on to the next tasks. You're done
Thank
with
you,
your
ma'am.
job. Yeah,
Thank you, ma'am.
no problem.
And how much grammatical errors matter?
So, doctor,
How
like I
much?
said, one or two, three or four, no more than that. No more than that. Mm-mm. 3, 4, maybe, barely. Okay, I think we have time to do one roleplay card. I think we can pull this off, so that you guys can know a little something about how the roleplay cards are done. If, who wants to go ahead and perform?
Yes, ma'am. I'm ready.
Okay, perfect. So, doctor, you have 3 minutes for reading. After 3 minutes are over, I'm gonna tell you to start performing. Is that okay?
Yes. Yes, this is okay.
Is that okay, doctor?
Yes, this is completely okay.
Okay. All right. Good luck. All right, doctor, are you ready?
Yes, I'm ready.
Okay, go on, please.
Am I audible now?
Yes, you're
Am I
audible.
audible, ma'am?
Mm-hmm.
Okay. Good evening.
Hi, good evening.
My name is Dilip Singh. I'm the treating physician here in the clinic today. May I confirm your name and age, please?
Hi, doctor. My name's Alex, and I'm 88 years old.
Okay. Okay, how may I address you, Alex?
You can just call me Alex.
Okay, Alex, thank you for sharing this information with me. Could you please tell me how could I help you today?
So doctor, like, as you know that I had my UTI. I think it was you were doubting that I probably had UTI, and we got some. I gave my urine sample last week. So are the results out yet?
Oh, I'm so sorry to hear about this. This could be really stressful for you. So let me review your reports of urine sample.
Okay.
Okay, Alex. I have reviewed your urine reports, and you have got condition called urinary tract infection. Are you aware of this?
Oh yeah, we talked about it last week, but at that time we weren't sure that I have it.
Okay, before proceeding further, I want to ask a few questions. Are you okay with that?
Sure, doctor. Go ahead.
Okay, could you please tell me how long you have been experiencing such episodes of UTI?
Doctor, it has been I mean, I have been having a pain during mixture for the last like couple of weeks, like 2, 3 weeks.
Okay, so you have any other symptom like burning sensation, difficulty in urinating, difficulty in stopping the urine, such symptoms?
No, doctor, not really. Just there was just a little bit of pain that I told you about, nothing more.
Okay, before going further, I want to ask one last question. Do you have any other ongoing condition like diabetes mellitus?
No, doctor, not that I know of.
Okay. Okay, Mr. Alex, I want to know about your diet, fluid intake, and exercise. Could you please tell me more about these things?
So doctor, I eat well with plenty of fresh fruits and vegetables. I drink about 2 glasses of water, 2 coffees a day. I think I'm otherwise very fit, healthy, very active. I walk for 15 to 30 minutes each day.
So I appreciate that you have got very good routine, and I want to congratulate on your that healthy lifestyle you have adopted. All right, and first I will encourage you to maintain a good hygiene. Good hygiene is very important. As you know, that this infection and most important risk factor of this infection is our bad hygiene. And furthermore, I will educate you on a technique called double voiding. Do you know about this?
Okay.
Okay,
No,
so
doctor.
first what you have to do is whenever you are urinating, you have to empty your bladder, then wait a moment, again try to empty bladder so that your bladder become completely empty, nothing remains. And this technique will help you to prevent from the recurrence of UTI. Am I clear?
Okay. Yeah, doctor.
Okay. Okay, so further, I will also prescribe you some antibiotics, which includes trimethoprim 300 mg per day for 3 days and a 3-month course of low-dose nitrofurantoin. Is it okay?
Okay.
Are you
Okay.
following me? Okay, and let me
Yeah.
reassure you that this condition is quite common, and I have seen a lot of patients of UTI, and they were doing very well on this medication, and they are really happy and satisfied. Are you getting
Dr.
me?
Zeep, your time's over.
Okay.
Your time's over, doctor. Yeah.
Okay,
I'm
ma'am.
sorry for stopping you abruptly, but the interlocutor will stop you in the same manner when your time is over. They don't give you a second extra.
Okay.
Okay, so
Okay.
Dr. Zeep, with you specifically, we have to work on your timings. You have to work on
Okay.
your like what to ask, what not to ask. For instance, like pain, or like the beginning questions that you asked me, which were not written in the task, but you just asked me out of your head, were not necessary. They were not written in the task. Always finish your task first, and then if you have anything extra to ask, like if there's any pain, or if there's any dysuria, like pain during micturition or whatever, ask those questions in the end after you're done with the task. You know what I'm saying?
Okay,
Yeah.
okay. Got it.
Yeah, so your task should have been directly started from asking about my diet fluids like you did,
Okay.
but you did it like at least 2 minutes later.
Mhm.
Yeah. And
Okay, ma'am.
apart from
How,
that, yeah, go on, please.
ma'am, how it's overall? Can you please comment?
If I were your interlocutor, Dr. Dilip, I would give you you did not complete your test, and I would give you a C positive, C plus.
Okay. Okay,
There's a
ma'am.
lot of room of yeah, there's a lot of room for improvement in your scenario, and we would definitely it takes like I've got students who are graded C, and then it takes them barely 1 week to go from C to A. So it's just really pretty basic and easy. For instance, when you did my introduction, you did not tell the interlocutor. You remember how I told you guys that you guys have to hint it out to the interlocutor that you know this is a returning patient, but you just
Ma'am,
kept
there's
on
nothing written
saying that, hey, so
is
go rinse your
returning patient. You just, ma'am, then the card is written that a patient come with urine sample reports. There's nothing written like patient is on follow up or on route like this. This is like a new patient.
then how have you been given the results from the urine sample?
So
You
maybe
have
some
seen the
other
patient.
GP have advised and they come to see. Okay.
Yeah. So you just received the results of tests performed on a urine sample that shows that you have a UTI.
It's the second visit,
So
so that
you
it's
just have
automatically estimated that the patient comes next second time.
I'll just add to this,
Okay.
Dr. Dilip. I'll just add, and Dr. Jaweria, sorry for interrupting, but
no problem.
I'll add to your point as well. It makes sense because, anyways, in a GP clinic, the patient is supposed to be following up. It's not a new patient, or it's not because this is the pattern, anyways, that the GP knows the
Yeah.
patient. So even if it is not written in the card, your returning patient, follow-up patient doesn't matter. I know the patient, and also setting it is mentioned. It is clinic, so I should be knowing the patient. It's in that particular area. So yeah, this was my point.
Okay. Good.
Thank you, doctor, for your insight. But you guys
Okay,
really
ma'am.
have to read between the lines, okay? So for instance, like you already had the urine samples and you were just about to disclose the results to the patient. So just be like, hey, we'd like you know that we just took your urine samples last week. So the results are with me. Do you want to know about your results? And the patient will be like, yeah, go ahead, please share them with me. And you'll be like, okay, so we just confirmed the diagnosis that you have UTI. Also, one more thing, Dr. Delete that when you ask the patient how they would like to be addressed, then please stick to what the patient is telling you. For instance, you asked me how you would like to be addressed, and when I said you can just call me Alex, you said, okay, nice to know that, Mr. Alex. So you do not add a suffix or a prefix in front of a name unless it's wanted by the patient. So these are like really miniature things if you think about these things, because you would say that, oh, this is such a petty thing, but these things are noted by the interlocutor by the interlocutor drastically. Okay, and that's the reason why we fail our exam, and and then we say that, hey, I did everything right. Why did I fail my exam? Okay, so do you guys have any questions, or do you guys want to do one more role play card? What
Dr. Jaweria, I have a
do you guys
question.
suggest?
If
Yes.
Dr. Jaweria, I have a question. Whenever the patient is come in our in the role player, so every time we are playing as in a GP role.
No, it's not
If
necessary.
local clinic
Sometimes
setting, if it's a clinic, so we said I am a GP at the clinic.
no. Sometimes you're in emergency department. Sometimes you're in a general practice surgery. For
Okay,
instance,
so
in
we
this
say
case,
that I am a Dr. Saima and I'm working in the emergency department, just like that.
no, I wouldn't say that. I would just say I'm your presenting doctor for the day.
Sorry.
Sometimes you're in ED. For instance, this one. Oh, nothing. I would just say that, hey, I'm your presenting doctor, and
Okay,
I'll be your
presenting
presenting
doctor
doctor. Yeah,
today.
for the day. Yeah, I would
Okay.
not say anything else. I wouldn't add to the fuel. So it's just better to play it safe. For instance, this patient came from ED, but you're still going to ask about their name and age and everything. Does anyone want to perform this?
Okay.
You guys do want to perform?
Can I do that?
Yeah, sure.
Okay.
You want 3 minutes for reading?
Okay.
Okay, go ahead, please.
And upon asking the patient his or her name, if the patient does not specify that the suffix should be used, is it recommended that we should use the suffix like Mr. or Ms. or Mrs.
No,
with the
that's what I
second
was
with the
telling Dr. Dilip, that do not use a suffix or a prefix. Do not. Unless the patient tells you that, hey, you can call me sir, or you can just call me madam, or you can just call me, you know,
all right.
apart from that, don't use anything. Just call them by what they are asking you to call them. Usually it will be just their first name.
Dr. Jaweria, I would want to add to that question as well. Now, regarding, okay, like for example, in the previous case, you have told that your name is Alex. Now, isn't it like okay, for example, so do you want me to address you Alex or with Mr. or Miss? Isn't it time wasting? Isn't it consuming time or something of that sort? Like if you keep asking the name and then Miss and Mr. and all that.
No, doctor. So it's written in the checklist of the interlocutor. You have to ask that question. If you don't ask that question, they deduct your mark. It's the medical ethic question. You have to ask that, hey, how would you like to be addressed? It took me 2 seconds, right? And then the patient said, hey, you can just call me Alex. Okay, we move on. 2 seconds, barely, 2 to 3 seconds. And you're gonna get a mark from the interlocutor easily. Okay, I hope that answered your question because I can't hear you anymore, but okay.
Yes, doctor. Yes,
Okay, it
because
did. Okay,
Dr.
perfect.
Fatma is reading the card now. That's
I
why I
know,
didn't want
that's why I was like, okay, Dr.
that's
Fatma, are you ready for the presentation?
Yes, ma'am.
Okay, so sorry for all the interruption.
No
Okay,
problem.
go on, please.
Good evening. My name is Dr. Fatma, and I am one of the doctors here in the hospital. So can I know your name?
Hi, my name is Linda.
Okay, and your age?
I'm 50 years old.
How would you like to be addressed?
You can just call me Linda.
Okay, Linda. So how may I help you today?
So doctor, I was lifting heavy weights at the gym this morning and I dropped like almost a 20 kg weight on my left foot. And then I just rushed to the emergency department so that I could get a cast put on my foot because I'm in a lot of pain, doctor.
Okay, Linda. I'm so sorry. It must have been very stressful for you and you are in so much pain. So before we proceed further, I would like to examine your foot. I would try to be as gentle as possible. Can I proceed?
Sure, doctor.
Okay, so based on your history and after my examination, I think your little toe is broken, but I want to reassure you that so it would be healed by itself with proper care. So are you following me?
Yeah, doctor, but I mean, it hurts a lot. I don't think it's just my little toe. I think it's my whole foot.
Exactly, I can understand your concerns, but as you see that I have examined your toe, and I want to reassure you that it's just your little toe that is broken. But I want to suggest some strategies, just non-pharmacological interventions that will help in alleviating your pain. So, do you want to try that out?
Sure, doctor, go ahead.
So first of all, you can elevate. It will also help in reducing your pain. Second, you can apply ice packs. That will also help, right? So after that, you can have some rest, and also till your pain subsides, you can avoid putting weight on it. So do you have any questions so far?
Doctor, I don't think that rest and elevation is enough to heal my foot. I think that a cast will support its rehabilitation.
Okay, Linda, I can understand your concerns, but let me tell you that a cast will not help the toe to heal, as I have told you that it will heal it on its own. And there are also some disadvantages of putting a cast. So, in terms of disadvantages, it can cause the atrophy of the other muscles, and as a result, it can make your rehabilitation more difficult. So, am I clear so far? Do you understand till now?
Yeah, doctor. Then what could be done for my foot if cast is not
Yes.
appropriate?
Okay, so I do suggest you some alternative. I strongly recommend you that you put on some splint. That would be more beneficial than a cast. It will also help you in, recovering more quickly, and along with non-pharmacological interventions, it will also help in quick healing. So, does that sound correct?
Okay, doctor, I guess.
Okay, so I understand now about pain. So in terms of pain relief, I recommend you paracetamol for pain relief, and and other than that, I want to recommend you to wear some sturdy shoes, some like heavy and sturdy shoes until the toe heals. That will take about 6 weeks. So it will also help in reducing your pain, and it will also help in healing your little toe. So you are following me?
Yeah, doctor.
Okay. So to summarize my all the discussion, first of all, I have told you about just interventions like elevation, ice, rest, and avoid putting weight. And secondly, I told you about the splint that you have to put it on in order to heal quickly, right? And after that, you have to take some paracetamol for pain relief, right? So I hope you understand till now.
Yeah, doctor.
So Linda, do you have any more question?
No, that would be all.
Okay, so thanks for visiting me. I would like to see you in a week or two, and I hope you a speedy. I wish you a speedy recovery. So you can have my card. You can contact me if you have any further query.
Doctor, your
I would
time's
like to
over.
answer that. Okay, goodbye.
Okay, goodbye. Okay, when the interlocutor tells you that your time's over, you stop speaking, okay?
Okay.
It's all right. You almost finished your presentation. It's just that you wasted a lot of time on task number 1, like elevation. You explained each and every word that's written. Elevation, that would help. Ice, that would help. Rest, it would help. Avoid putting the weight. It would no, don't do that. Just be like, hey, there's a little tips and tricks, the non-pharmacological interventions to help you go through this. For instance, elevation, ice, rest.
Okay. I
And
think
then
I
once
have
you're
a
like,
lot
wait,
of
wait a
time.
minute, just just go flow, like just in the rhythm, just get it done with. You don't have to explain each and every word. You're gonna run out of time so fast and then if you don't
Okay.
finish your scenario, it doesn't leave a good impression on the interlocutor. So always try to finish your scenario.
Okay, I
Always
will
try to
consider.
finish. Yeah.
Okay.
You were almost there. It's just that I think you wasted a little time and then if you wouldn't have summarized, then I think you would have finished, but you decided to summarize and that wasted another minute.
I think I
So
have
yeah.
finished my task, so that's why I want to summarize.
Yeah, then just try wrapping it, just start wrapping it up because that's gonna take at least 15 seconds as well. Just the
Okay.
fact that you're gonna be like, hey, so is that clear? Do you have any more questions? Okay, then I will see you in a week. Wishing you a speedy recovery. Here's my card. You can keep it. Let me know if you have any more questions or queries. That's gonna take at least another 10 to 15 seconds.
Okay.
Yeah,
Okay,
so
doctor.
just wrap it up. Yeah, wrap it up.
Okay,
Dr. Jaweria?
how would you grade my task, Dr. Jaweria?
I would give it a B plus.
Thank you, doctor.
Dr. Jaweria, should we give at the end, we give the leaflets and for written leaflets?
Leaflets if it's necessary. So if a patient is diagnosed with something new, for instance, COPD, for instance, asthma, for instance, diabetes, for instance, something that needs to be studied on a little, that requires information, then give a leaflet. If it's something like a broken toe, you don't give a leaflet. If it's something like that's been there in the family history and he's been treated for it for last 10 to 15 years, it's nothing new for the patient. Do not give a leaflet. Just something that
Okay.
has been diagnosed and the patient wants to know a little bit about it, then go ahead and give a little pamphlet or a leaflet.
Like in a previous case, a UTI, and he want to know about and worried about the
No,
recurrence of the UTI.
we don't. We cannot. He had a recurrent
We can,
UTI, so he has had UTIs before, right?
yeah.
So we don't. So it's very technical. Like as you guys practice, then you guys will know. For instance, I had this case scenario in which the doctor doubted that the patient might have Hodgkin lymphoma because the patient had lymphadenopathy, and the patient was sent for a procedure that, okay, let's just find out that if you have lymphadenopathy or not. But in the end, the student was like, okay, so here you go, this is a leaflet for on Hodgkin lymphoma. And I was like, oh my God, you don't do that. It's not confirmed yet, it's not diagnosed yet. You're just sending the patient for getting their blood work done and stuff like that. So we don't give a leaflet if you have a doubt about something, or if it's something that the patient has had for years. Okay, so I hope I answered the questions, and please sign up for the course if you guys want to.
I just have the last question, if you could please
Yeah,
address
sure,
to
go ahead,
that.
please. No
How
problem.
to incorporate proper stress and intonation in our speaking role?
Just by practicing, doctor. There's no magic trick that could teach you how to incorporate stress. Just,
Because being a non-native speakers, because we are generally as per I can talk for the Pakistanis, because we have a monotonous, a monotone. We don't have a proper upper rhythm and low rhythm. We don't have that. Does it matter?
I mean, it does leave a really good impression if you do know on which words to stress on. It does sound very fancy, and the interlocutor will be like, hey, so this person knows how the drill. But if not, if you have, like you said, we have a very monotonous accent, then too it's fine. But if you get an interlocutor like me, then I would definitely get fancied by stressors and by, like the Lexes. And I think as soon as we just practice, and if it's your forte that you want to work on, we can definitely work on it together. It just
Right.
comes with the speech, by listening and by practicing. So there's certain words that you stress upon, and it just comes with practice. That's all
Okay. Okay.
I
Thanks,
I can
heaps.
um yeah, no problem. Okay, so do we have questions? Are we done? Okay, so I hope you guys had a wonderful session, and please sign up for the course if you guys want. I think Faizan could guide you guys better, and he has been I don't Dr. Asif Hashmi, I'm not sure if you guys could get a recording for this one. But I mean I can ask Faizan about this.
Okay, ma'am.
Okay, Dr. Asif, you were the one who asked about the stressors, right?
Yes.
So one more
That-
tip that I could give you is that listen to the recordings of the sessions repeatedly. Listen to the
Right.
recordings, that would help you as well. Because just listening to me speaking in one session is not enough for you to grasp how to work along with it. But if you listen to the recording, it would help you with just like figuring it out, because at that time you would only be listening from the perspective of listening to the specific thing, a specific context. So that would help you as well.
Okay, ma'am.
Yeah.
Thank
And
you.
watch the
Thank you
YouTube
so much.
videos that they have. They have a really good stuff going on over there. It's
Sure, ma'am.
like
Sure,
really
ma'am.
good.
I'll give it a go. Thank you.
No problem. No problem. Okay, guys, so it was a wonderful session with you guys. I hope to see you guys in my live sessions, which are starting from April 18th. It would be a blast if you guys could join in. And we have a lot of fun during our live sessions, and then we give out assignments every week. So it's double the practice, and we're always there to answer your questions. So it's like a win-win situation for you guys. So hope to see you guys soon. And Faizan has been dropping the contact details in the chat box. So please go ahead and sign up. I'll see you guys I think on the April 18th, maybe. I don't know when my next session is, but during my live sessions. So goodbye, everybody. Thank you.